Hello guys, I am Dr. Rahil Gohar. I am a consultant neurosurgeon in a public sector in Pakistan, basically from Karachi. So today we are going to discuss about a very important topic, which is CT scan brain plane. I have divided this video into two parts. In the first part, we are going to discuss about the CT scan brain anatomy, how to identify different anatomical structures on the CT scan brain plane, and then in the second part of this video, we are going to learn about different pathologies which we can identify on the CT scan brain plane. So let's begin with the first part. Let's okay now. So starting with this, so I have divided this video again into three parts in a sense that in the first part we are going to discuss about different densities of the CT scan brain plane, and then we are going to understand the basic anatomy, and then we are going to learn all those anatomical structures on the CT scan brain plane. So let's start with the densities. So basically, when we are seeing a CT scan brain plane, there are three colors which you can visualize here. The first color is the black color, as you can see here. Then we have a gray color, and then finally the white color. So there are three densities on the CT scan brain plane. All those pathologies which appear like this brain parenchyma, which is appearing right now gray. So whatever the pathology is, if it is appearing like gray in color, then we call it isodense, means it is similar to the brain parenchyma. Whatever the pathology, if it is appearing hypodense, means blacker as compared to the brain parenchyma, it is known as hypodense. Like this CSF here is normally hypodense as compared to the brain parenchyma. And whatever the pathology or normal structure which is hyperdense or whiter as compared to the brain parenchyma is known as hyperdense. So bone is actually hyperdense as compared to the brain parenchyma. And there is one more thing which is black as compared to the brain parenchyma, which is air, as you can see. So this is the frontal bone, and in the frontal bone we have got the frontal air sinus. So this is appearing black. So CSF, as you can see in the ventricles, and the air appears hypodense. The brain parenchyma is gray in color, and finally the bone or normal calcifications inside the brain, they will appear hyperdense. Now moving towards different Hounsfield units. So basically all these densities which I have talked about, they have got a particular number assigned to them, and these are known as the Hounsfield units. So I will talk about three things. As you can see here, that the water or CSF will have a Hounsfield units of 0, so it will appear black. And then the bone has Hounsfield units of 1000, it will appear white, hyperdense. And the air has a Hounsfield units of -1000. Here you can see again that the air is the most black and the cortical bone is the most white. So and all the structures are in between are in different Hounsfield units, and in different, it can appear black, it can appear gray, or it can appear white, or whatever the pathologies. For example, here you can see there is a hyperdense area inside the brain parenchyma. So this is actually acute blood, which I will discuss later. Now moving towards different sections. Usually when we in our setup in public sectors, or in traumatic conditions, when the patient comes to us, whenever we perform the CT scan brain plane, it usually in like this. So we only get the axial sections. So we have usually three sections, we all know about it. One is this horizontal section here, which is shown here, means the axial section. Then we have the sagittal section. We have divided the brain to the midline, and we are seeing this one here on the CT scan brain plane, you can see. So this one is the sagittal view. Finally, the coronal view we have cut from the AP in the AP direction, and now we are seeing from the front side. So this is the AP of the CT scan brain. So these are different sections, different planes, and usually we get to see the axial sections, so which you can see here in this picture. Let's move forward. So this is the basic orientation of the CT scan brain plane. Usually when we see the CT scan brain plane, they usually start from the base of the skull, and then the cut sections are towards the apex of the vertex of the skull. So here you can see there is a section which is showing the maxillary sinus, and then posteriorly we have the cerebellum, and then as we go upward we can see the different parts of the brain. Now, the CT scan brain plane is divided into two films. One is the parenchymal window, where you can see all the pathologies within the brain parenchyma. As you can see here, we can see different parts of the brain parenchyma here. Then we have a bone window. In the bone window, we usually obscure the brain parenchyma, but we want to see the bone. What are the pathologies in the bone? For example, we want to see the fractures. And also pneumocranium. Pneumocranium is a condition in which there is accumulation of the air inside the intracranial cavity. So we can see that as well in the bone window. As you can see in this bone window, there is a fracture here, and it is the fracture of the frontal bone. So this is basically the bone window is basically to identify different pathologies of the bone. So let's move forward. So in the skin brain anatomy, we are going to identify the fossas, lobes, nuclei, dural folds, ventricles, different bones, cisterns, air sinuses, normal calcifications, and vessels. So let's begin with the normal anatomy first, and then we will identify all those anatomical structures in the CT scan brain. So let's begin. So there are basically three cranial fossas. Now, what are the cranial fossas? Now we have, we have got the skull cavity. So this is the cranial vault, and we have the base where the brain where our brain is sitting. So if we remove the vault of the skull and we are looking inside, there is a brain. We have removed the brain as well. Now we are seeing the base of the skull. So this is the base of the skull which we are seeing here. So the base of the skull is divided into three parts. One is the anterior cranial fossa, one is the middle cranial fossa, and finally we have got the posterior cranial fossa. So in the anterior cranial fossa, we have basically three bones. This blue color structure is the frontal bone, this is the ethmoidal bone, and finally in the yellow we have the sphenoid bone. Now the anterior cranial fossa anterior margin is bounded by the frontal bone, and the posterior boundary is bounded by the sphenoid bone, or we can see the laser wing of the sphenoid. So this is basically the anterior cranial fossa. Then the middle cranial fossa starts from the laser wing of the sphenoid, and this part is known as the pitras part of the temporal bone. So from the laser wing of the sphenoid up to the pitras bone, we have got the middle fossa. Then this maroon color structure is the temporal bone. This one yellow color structure is the greater wing of the sphenoid. So this is the laser wing of the sphenoid. This is the laser wing of the sphenoid. This is the greater wing of the sphenoid. Here, these two structures are the anterior clinoid process. These two structures are the posterior clinoid process, and this is the cilia tracheca. So these all are parts of the sphenoid bone. Then moving posterior to the pitras bone, we have got this posterior fossa, posterior cranial fossa. It is mainly formed by this bone, this orange color bone, and this is known as the occipital bone. Now there are some other things which I would like to discuss here as well. Here you can see a very big foramen, very big opening. This is the foramen of Magnum, from where the spinal cord, from where the brainstem is converted into the spinal cord. So this is important as well. Also, let's discuss it later on about the tentorium cerebelli. So moving towards the lobes of the brain, we all know that the brain is divided when we are talking about the cerebrum or cerebrum. So we have the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe, and then we have the brainstem and the cerebellum. Now, what I was talking about the tentorium cerebelli, that there is a fold of dura which divides the intracranial cavity into supratentorial and intratentorial compartment. So here it is not shown here, but here will be the tentorium cerebelli, which is the dural fold which divides the intracranial cavity into supratentorial compartment. So in the supratentorial compartment, we have all those four lobes: frontal, parietal, temporal, and occipital. And in the intratentorial compartment, we have got the brainstem and the cerebellum. So brainstem is basically divided into three parts. This one is the midbrain, then we have got the pons, and then finally we have got the medulla oblongata. So these are different parts of the brain which we are going to identify in the CT scan brain plane. Now again, this is the anterior cranial fossa we've already discussed. This is the middle cranial fossa, and then the posterior cranial fossa. So in the CT scan brain plane, this is the bone window, this is the parenchymal window. So in the bone window, you can see this one is the anterior cranial fossa, this is the lateral wing of the sphenoid, this is the frontal bone. So in between them, this is the anterior cranial fossa. Then between the lateral wing of the sphenoid and the pitras bone, we have the middle cranial fossa. Here you can see one more thing, that there are black color shadows you can see inside the pitras bone. This is the mesoid part of the pitras bone where the air cells are present. So the air will present hypodense in the CT scan brain plane. So this is the mastoid part of the petrous bone. Again, then posterior to the petrous, we have got the posterior cranial fossa. Here you can see these structures here in the white color. These are actually the tentorium cerebelli, because the tentorium cerebelli is attached to the petrous bone and then finally to the posterior clinoid. So as I have already told you, this structure here is the posterior clinoid, this is the petrous bone. So the tentorium cerebelli attaches here. So this here we can see as well. Again, this is the sella turcica region where the posterior fossa is, or where the pituitary fossa is. Now again you can see in the anterior cranial fossa basically holds the frontal lobe, the middle cranial fossa basically holds the temporal lobe, and finally posteriorly in the posterior cranial fossa, I have already told you, we have got the brainstem and the cerebellum. Now this is very very important. Now we are seeing the lateral view of the skull, and we have removed the bone, and now we can see the lobes of the brain. Now when we are discussing about the base of the skull, we usually think that it is the flat, it is flat, but it is not actually flat. When we are seeing the lateral, you can see it is like stairs. So this is the frontal fossa, anterior cranial fossa, this is the middle cranial fossa, and finally this is the posterior cranial fossa. So in the anterior cranial fossa, it is actually holding the frontal lobe. The middle cranial fossa is holding the temporal lobe, and finally here is the tentorium cerebelli in between the supra and infratemporal compartment, and the posterior cranial fossa is holding the cerebellum in the brainstem. Again, you can see here in the CT scan brain sagittal section, this is the frontal lobe, this is the temporal lobe, parietal lobe, and finally we have the cerebellum. And this white structure shown here is the tentorium cerebelli. Let's move forward now. Here, now why am I again showing this picture to you? This is very very important, I'll explain to you. So when we are seeing the lateral view, this is the frontal lobe, parietal, temporal, and occipital lobe, and then we have cut the brain in the midline, and now we are seeing the lateral view, but this is the medial side of the brain because we have cut it in the midline. Now again you can see different parts, and basically this is to show you the brainstem and the cerebellum. So this is the midbrain, pons, medulla oblongata, and this is the cerebellum. Now let's show you something very very important here. So when we are taking the cut sections of the brain, because we will whenever we see the CT scan brain plane, they are usually in axial sections. So when we are seeing the axial section, the axial sections are taking started from here. So there will be one axial section from here. So initially we will only see the maxillary sinus and the cerebellum, no other structure. Then there will be sections from here where you will see the anteriorly the eyes, then the temporal lobe, and posteriorly we will see the brainstem and the cerebellum. As you move upwards, you can see we will see the again we will see the orbital plate, then we will see the temporal lobe, occipital lobe, and then as we move upwards we will see the frontal lobe, temporal lobe, occipital lobe, and as we move up we will see the frontal, parietal, occipital, and finally we will only be able to see the frontal and the parietal lobe. So as we move upwards, what will we will see, I was telling you about it. Now very important thing is, I talked about the tentorium cerebelli. So tentorium cerebelli is not like this, it is not a straight structure, it is like a tent like this. That's why it is called as tentorium cerebelli. So you can see that the tentorium will be here like this. So the cerebellum is going in the tent like structure. So when we get a cut section from here, so you can see that anteriorly there will be eyes or the maxillary sinus, then the middle, in the middle cranial fossa we will see the temporal lobe, then finally posteriorly we see the pons or cerebellum, and then also the occipital lobe as well. So there will be sections of the brain where we will see the supra and infratemporal structures both together posteriorly. Usually what we think in the axial section, that there will be a section where the infratemporal compartments convert into the supratemporal compartment, but there will be section in which in the posteriorly in the center we will see the cerebellum, and in the periphery we will see the occipital lobe. And again if I take the section from here, I will see a little part of the cerebellum posteriorly in the middle, and in the periphery I will see the occipital lobe like this. So if I take a section posteriorly, there will be cerebellum like this, and in the periphery I will see the occipital lobe. So this I am explaining this to you because because you will get confused when seeing the different sections of the CT scan brain plane. So that is why I'm explaining it here. I will again show you the axial sections as well so that you can understand it better. So let's move forward. Now here, this is also very important. I have already told you that there are mainly four lobes of the brain supratemporally. In the cerebrum, we have four lobes, but actually there are five lobes. This one is known as the frontal, parietal, occipital, and temporal. These are the four lobes. But when we cut the lateral side, lateral surface, or we open the frontal and the temporal lobe like this, we will see one more lobe. This is known as the insular cortex. Because it is sitting deep, so we cannot see it from the lateral side, from the lateral surface. If we open up the frontal and the temporal lobe, then we will be able to see the insular cortex. So in this axial section, if we take a section from here like this, so in this axial section you can see here we are going inside, and now usually when we are seeing the lateral surface, you can see these convoluted structures. These are known as the gyri, and these are actually representing the cerebral cortex. So this is the cerebral cortex. You can see outside there are gyri visible, but now as you can see deep deep within the brain, you can see again the gyri visible. So this is the cortex which is present deep inside the outside cerebral cortex. Means from the frontal lobe, from the temporal lobe, or parietal lobe, or occipital lobe, there is another cerebral cortex which is inside and deeply present. This is known as the insular cortex, as you can see here, bilaterally present. This is the fifth lobe of the brain. The people usually call it the fifth lobe of the brain. Before we move forward, I want to show you two more structures. Here you can see this. In between the gyra we have the subarachnoid space, and these subarachnoid spaces are containing the CSF, and these are called as sulci. So here you can see between this red color structure and frontal lobe and parietal lobe, we have got this sulcus here. This sulcus here is called as central sulcus. So in front of the central sulcus we have the frontal lobe, posteriorly we have the parietal lobe, and there is second important sulcus as well. This is known as the lateral sulcus. So this lateral sulcus is actually a boundary between the frontal parietal and the temporal lobe. So these two structures should be remembered. So here in the axial section, this sulci which is going inside is actually lateral sulcus in the cut section. Okay, this is also known as the Sylvian fissure as well. Now let's discuss about the bones of the skull. Most of you know about these bones. This is the purple color bone. This is the frontal bone. Laterally you can see this is the parietal. This is the greater wing of the sphenoid. This one is the temporal bone. This is the occipital bone. And again in the base of the skull we have already discussed all these bones. Now the air sinus is in the cells. So basically there are certain bones which are pneumatized, means they have got the air sinus inside them. So what are these bones? It's martel bone. The frontal bone contains the air sinuses. The sphenoid bone contains the sphenoid sinus, and the petrous bone contains the mastoid air sinus, mastoid air cells. So here you can see this is the martel bone. It contains the air sinuses. Then we have the sphenoid sinus. Here you can see. Then posteriorly we can see the air sinuses of the mastoid bone within the which is the part of the petrous bone. So here you can see on the bone window. Then moving forward, we have got some important sutures which we have to identify on the CT scan brain plane, and these will be the landmarks with the help of which we can perform different surgeries as well. So this is the frontal bone. These are the two parietal bones. So between the frontal and the parietal bone, this structure here is actually the coronal suture. The between the two parietal bones, this structure here in the center is the sagittal sinus, sagittal suture. Then finally, posteriorly, we have this structure here between the occipital bone and the parietal bone. This is known as the lambdoid suture. So these are the three important sutures. Then if we see the lateral view, this is the temporal bone, this is the parietal bone. This structure here is the squamous suture. So these are some of the important sutures which you should remember, which we will be able to identify on the CT scan brain plane as well. Now, the anatomy of the sulci and gyri, we all know that the brain is convoluted, and these convoluted structures are known as the gyri. In between, we have got the CSF spaces. As you can see, this black color structure, these are known as the sulci. Basically, we have the three membranes of the brain which are covering the brain. This is the pia mater, this is the arachnoid mater, and finally the dura mater. Between the pia and the arachnoid, we have got the subarachnoid space, and this is the space which is containing the CSF, cerebrospinal fluid, as well as the vessels. And then finally between the arachnoid and dura mater we have got the subdural space. And then finally we have got the dura mater. Dura mater has two layers. One is the meningeal layer and another is the periosteal layer. So there are two layers of the dura in the brain. So these are the three layers of the meninges which you should remember. Then moving towards the anatomy of the ventricles, of course, we will be able to identify the ventricles as well on the CT scan brain plane. So there are four ventricles, two lateral ventricles, one third ventricle, and the fourth ventricle. So here you can see on the lateral view, these are the lateral ventricles. Lateral ventricles have got different parts. So these are known as the frontal horns of the lateral ventricles. These are the occipital horns, and these are the temporal horns. This is the body of the lateral ventricle. Then we have got this third ventricle. It is single and it is connected to both the lateral ventricles via the interventricular foramen or interventricular foramen or the foramen of Monro. Finally, this third ventricle is connected to this fourth ventricle via this aqueduct of Sylvius or the cerebral aqueduct. And finally, the fourth ventricle is opening into the subarachnoid space through the foramen of Lashka laterally and foramen of Meninges posteriorly. And then the CSF comes into the subarachnoid space and around the brain and around the spinal cord. This is the coronal view. In the coronal view, you can again see these are the lateral ventricles. They are connected to the third ventricle. Third ventricle is slit-like structure connected via foramens, and these are known as the foramen of Monro or interventricular foramen. Finally, this third ventricle is connected to this diamond-shaped fourth ventricle via the cerebral aqueduct. And finally, it is opening into the subarachnoid space via these foramens. This is very important to see that this structure here is the pons and this is the medulla oblongata and this is the cerebellum. So the fourth ventricle is present behind the pons and medulla oblongata and in front of the cerebellum. This should be remembered. This is very important. We are going to identify it on the CT scan brain plane. So again in the axial sections you can see these are the lateral ventricles. As we go down, these are the frontal horns, these are the interventricular foramen, this is the third ventricle, this is the occipital horn, and here inside you can see this bluish and reddish structure. This is known as the choroid plexus, which is actually producing the CSF. Here you can see again in the occipital horns. So basically the choroid plexus is present in the lateral ventricles and in the mainly in the fourth ventricle, and it is producing the CSF. Then as we go down, this is the pons, this is the cerebellum, in between we have got the fourth ventricle. So it is how we are going to see the ventricles on the CT scan brain plane. Then there are some of the very important nuclei which are present deep within the cerebral, within the cerebrum, deep within the cerebrum. These are known as the basal ganglia and the thalamus. Basal ganglia is basically made up of 5 parts: caudate nucleus, putamen, globus pallidus, subthalamic nucleus, and substantia nigra. You don't have to remember all those names, but the 2 to 3 names you have to remember so that you can identify them on the CT scan brain plane. So here you can see these were the frontal horns of the lateral ventricle. So adjacent to them, it is the caudate nucleus. Then this triangular structure you can see is the lentiform nucleus, which is divided into 2 parts: putamen and globus pallidus. And adjacent to third ventricle bilaterally, we have got these structures which are known as thalami. So then we have got a cisterns. So what are cisterns? We all know that between the pia and the arachnoid matter we have got the subarachnoid space, and around the gyra, in between the gyra we have got the sulci, which are actually the subarachnoid spaces. Now around the brain stem, these subarachnoid space gets dilated, and these dilated spaces are known as the cisterns. So in the jet view you can see these blue structures. These are actually the subarachnoid spaces or the cisterns. These are also known as the basal cisterns around the brainstem. So this is the midbrain. In front of the midbrain, we have got the interparenchymal cistern. Then in front of the pons, we have got the peripontine cistern. Simply behind the brainstem, this is known as the quadrigeminal plate. So it is a quadrigeminal cistern. And this cistern here between the cerebellum and the medulla oblongata, this is known as the cisternum magna. This is the largest cistern of the brain. Here again you can see the brain stem or the midbrain is actually a heart-shaped structure like this. You can see here. So these are 2 peduncles, cerebral peduncles, and behind we have got the quadrigeminal plate, superior and inferior colliculi. So there are different cisterns. In front we have got the interpedunclar cistern between the 2 peduncles. Then this one is the crural cistern here. This one here is the ambient cistern, and posteriorly we have got the quadrigeminal cistern. Together all these cisterns are called as basal cisterns. In the center of the midbrain you can see this structure, this is known as the cerebral aqueduct, which I have already discussed, which is connecting the third ventricle with the fourth ventricle. And then as we all know, there are two cerebral hemispheres now, on the right side and the left side. So these two cerebral hemispheres are actually divided in the center by a fold of the dura mater, which is known as the falx cerebri, as you can see here. And in the same way, the intracranial cavity is divided into supra and intratentorial compartment by another dural fold, which is known as the tentorium cerebri, as you can see here. Then there are different, of course, the brain has got the blood supply as well as the venous drainage. So these are the different venous sinuses which are actually which actually forms due to the separation of the dura mater uh, between the two layers of the dura mater. So this is known as the superior sagittal sinus, and in the inferior part of the falx cerebri we have got the inferior sagittal sinus. This is the straight sinus. Then laterally in the occipital bone we have got the transverse sinus, sigmoid sinus, which eventually will drain into the interjugular veins. Then the arterial supply, this is known as the cycle of Willis. We all know about it, but let's discuss it. These we have got the anterior circulation, internal carotid artery, and posteriorly we have got the vertebral arteries. So here you can see the internal carotid artery. It is divided into middle cerebral artery and the anterior cerebral artery. And posteriorly we have got two vertebral arteries which combine to form the basilar artery. Here this is the basilar artery. Then the basilar artery finally divides into posterior cerebral arteries. So this is the posterior circulation, this is the anterior circulation. Now the anterior circulation is connected to the posterior circulation via this artery, which is known as the PCOM or posterior communicating artery. Anteriorly both the anterior cerebral arteries are connected together via the anterior communicating artery. So this is known as the circle of Willis. And the lateral surface of the brain is usually supplied by the middle cerebral artery. The inferior temporal lobe and the occipital lobe is supplied by the PCA, posterior cerebral artery. The medial part of the brain, as you can see in the sagittal section, is supplied by the anterior cerebral artery usually. So this is all about the anatomy of the brain. Let's begin. Now we have discussed all the basic anatomy. Now we are going to identify all these anatomical structures on the CT scan brain plane. So let's begin. Now I am starting from the base, and then we will move upwards to identify the different structures. So here you can see we have taken a section. This section is slightly below than this section which is shown here, because in the anterior part you can see the maxillary sinus, nose. Then as we go posteriorly, this is the laser wing of the sphenoid, and this is the pitras bone. So in between the laser wing of the sphenoid and the pitras bone, we have got the middle fossa, and the middle fossa is holding the temporal lobe, as you can see here as well in this section. So this is the temporal lobe, and as we go posteriorly, we have got the medulla oblongata and the cerebellum, because the lower part of the brainstem is the medulla oblongata, then pons, then the midbrain. So this is the medulla oblongata, and this one here is the cerebellum. So again you can see here, these are the eyes. This is the section here which is shown in the CT scan brain plane. So these are the eyes, ethmoidal air sinuses, this is the laser wing, then the vitreous part, and this is the external auditory meatus. So this is the temporal lobe, this here is the medulla oblongata, and this here is the cerebellum. As we move upwards, now we have taken upward section. Again you can see the eyes, the ethmoidal air sinus, and this is the sphenoid bone, this is the pitras bone, this is the mastoid air cells, and these are two temporal lobes. This is the, again this is the pons, this is the cerebellum, and this is the fourth ventricle. You can see in this picture as well. Now as you can see, we have taken a section like this, and it is going to the occipital lobe. So in the periphery you can see the occipital lobe as well. I've already explained to you that the tentorium cerebelli is like this. So we will have in the center the cerebellum, and in the periphery we will start to see the occipital lobe. So in the periphery you are starting to see the occipital lobe here. How can we identify that this is the cerebellum? There are horizontal folliculi, as you can see here. These are folliculi which can be identified on the CT scan brain plane, and you cannot see, but I will show you later in the later slices. So we have got this, the laser wing of the sphenoid, this is the pitras, this is the mastoid air cells, this is the temporal bone, and this one is the occipital bone. So in between the laser wing of the sphenoid and the pitras bone, we have got the temporal lobe, and behind the pitras bone we have the posterior cranial fossa. So we have got the pons, the fourth ventricle, and the cerebellum, because the fourth ventricle was present between the pons, medulla oblongata, and the cerebellum. So this one is the fourth ventricle, as you can see here. Now moving upwards, we have taken this section. So again we have got this petrous bone. Now we have got the sphenoid bone. Here there will be the petrous bone. This is the temporal lobes. This is the pons, fourth ventricle. This is the cerebellum, as you can see, these folliculi. Okay, and posteriorly we have got the cerebral occipital lobe. So again you can see here that posteriorly we have got the occipital lobe as well. So this is the laser wing of the sphenoid. This is the petrous bone. Again we have got the temporal lobe, pons, fourth ventricle, cerebral hemisphere, and posteriorly we have got the occipital lobes. Here we have the sella, and you can see here the air as well. So this is the sphenoid sinus. Its layer cells, the eyes. Let's move forward. Now we have gone and taken a section from here. So here it is now going through the superior orbital plate of the orbit. This is the frontal lobe, this is the temporal lobe, and finally the occipital lobe, and in the center we will see the cerebellum. So again you can see this is the frontal lobe. This here in the center is the falx cerebri. Falx cerebri was the dural fold which was dividing the frontal lobes. Here you can see this is the midbrain. It is a heart-shaped structure. So these are the cerebral peduncles. This is the cerebral aqueduct. Cisterns are also visible. This one is the interpeduncular, then the crural, ambient, and posteriorly we will see the quadrigeminal cistern. Now here you can see the folliculi. So this is the cerebellum, and posteriorly we will see the cerebral cortex or occipital lobe. So again you can see we have got this frontal lobe. Bilaterally we have got a temporal lobe. This is the midbrain, the cerebral aqueduct, interpeduncular cistern. This part in the center is the cerebellum, and we have got the occipital lobes as well. Let's move forward. Now again we have taken a section from here, and you can see that basically only a small part of the temporal lobe is visible here, and we are now moving towards the frontal lobe, the parietal lobe, and the occipital lobe. This here is the central sulcus. This here. So this is the frontal lobe. This is the Sylvian fissure, because we are taking section from here. So this here is the lateral sulcus of the Sylvian fissure. So it is visible here, and as we move inside, this structure here is the insular cortex. This should be remembered. Then again, as we go posteriorly, a small part of the cerebellum is visible, and the occipital lobe is visible, and the parietal lobe is visible. Now again, as you can see, also I want to tell you that in between the two hemispheres, this is the falx cerebri, but you can see the CSF species as well. So this is known as the interhemispheric fissure or interhemispheric sulcus. So you can see this is the frontal lobe, this is the Sylvian fissure or the lateral sulcus. Inside we have got this structure which is known as the insular cortex. This is the midbrain. Posteriorly we have quadrigeminal cistern. As you can see, these folliculi, horizontal folliculi. This is the cerebellum, and posteriorly we have occipital lobe. Now it should be remembered that as we go upward, we have got the fourth ventricle, the cerebral aqueduct, and then the third ventricle and the lateral ventricles. I am talking about the ventricles. So in front of the midbrain, upper midbrain, we have got this cylind type structure. This cylind type part of the ventricle, it is known as the third ventricle, as you can see here as well. This is the third ventricle. Now as we move upwards, we have got the parts of the ventricles above the third ventricle. So this is the third ventricle. It is connected via the foramen mono to the lateral ventricle, the frontal horns of the lateral ventricle, and posteriorly we have got the occipital horns of the lateral ventricles, and this is the choroid plexus. And normally there are certain structures in the brain in the adults which gets calcified with the passage of time. So this includes the basal ganglia structures. It can be the falx cerebri, it can be the pineal gland, and it can be the choroid plexus as well. So again, this is the interhemispheric fissure. These are the frontal lobes. These are the parietal lobes, and the Sylvian fissure as well, insular cortex, and posteriorly we have got the occipital lobe. Now again you can see here, this is the interhemispheric fissure. These are the frontal lobes. This is the frontal horn of the lateral ventricle. Then we have got a small part of the third ventricle, occipital horns, and the calcified choroid plexus. Then this structure here is the Sylvian fissure, and this is the insular cortex. And posteriorly you can see we have got the occipital lobe. This is the interhemispheric, or this is the falx cerebri. Posteriorly you can see this triangular structure. This is actually a superior sagittal sinus, as you can see here in the cut section. Okay. Now as we move forward, now here you can see adjacent to the frontal lobe we have got another collection of the cell bodies. So the collection of the cell bodies is actually outside, which is known as the cerebral cortex. But if the collection is present inside, it is known as the nuclei. So this is the cordate nucleus. We can see adjacent to the frontal horns. This one is the putamen and the lentiform. This here are bilaterally present adjacent to the third ventricle. These are known as the thalami. So you can see here as well, this is the caudate, this one here is the lentiform nucleus and bilateral thalami, as you can see here, bilateral thalami. So in the next picture you can see very easily that these are the caudate nucleus, lentiform and the bilateral thalami. Now before maybe moving forward, as I have already told you that this is the cerebral cortex. Now the neuron has basically three parts: cell bodies, axons and dendrites. Now forget about the dendrites. So we have got the cell body and the axon. So the cell body is actually forming the cerebral cortex and the axons are actually forming the white matter. So this structure here, you can see this is the cerebral cortex. So it is containing the neuronal cell bodies, and this white structure is actually the axons. So when all these white structures are coming down, these are known as the coronal data, and they start to accumulate at one point. And that one point is known as the internal capsule, and then from there the white matter goes down. So here you can see all the white matter which is coming is constructing here. This is known as the internal capsule. It is between these nuclei, different nuclei. So here again you can see between the caudate, lentiform and thalami, these are known as the internal capsule. These are the white matter fibers which are coming from the cerebral cortex. So it has to go three parts: anterior limb, posterior limb and the genu. Moving forward, we have taken a section from here, and as you can see we have the frontal, parietal and occipital lobe. So again this is the frontal lobe, this is the parietal lobe, internal capsule can be seen, and posteriorly we have got the occipital lobe, and we have got the lateral ventricle, and these are the choroid plexus. Now as you can see this is the lateral ventricle, and inside this gray structure and in the lateral ventricle these gray structures are the choroid plexus. Now this is very important. It should be remembered because we are going to use it in the pathological. It has got a pathological significance as well. Now I have already told you that the cell bodies are forming the cerebral cortex. So this is known as the gray matter. Inside the axons form the white matter. Again you can see this is the gray matter and this is the white matter. I've already told you the parenchyma appears gray on the CT scan brain plane, but this gray has also got two colors. As you can see, this white matter is appearing more darker as compared to the gray matter. So the white matter on the CT scan appear darker as compared to the gray matter. So as you can see here, we have got a distinction between the gray and the white matter. This is known as the gray-white differentiation. It has a significance because whenever there is ischemia due to arrest ICP or due to infarction, this gray-white differentiation is lost. If it is focally lost, it is known as the infarction, and if it is globally lost, it is known as it is because of the arrest ICP. So again, you can see now we were talking about the cisterns. So we in front we have got the in front of the midbrain we have got the interpedicular cistern. Then we have got the ambient cistern, quadrigeminal cistern, and here we have got the crural cistern as well. Anteriorly around the optic chiasm and pituitary, we have got a suprasellar cistern as well. Again, you can see different cisterns. Here you can see this is the medulla oblongata and cerebellum. Posteriorly, you can see CSF space here. This is known as the cisterna magna. In the sagittal section, again you can see this is the cisterna magna. This is the fourth ventricle. This here is the quadrigeminal cistern. Different sutures. Now why we are discussing the sutures? Because it is very important to differentiate a suture from a fracture. So how to differentiate a suture from the fracture? First, before moving towards that, the skull bones are actually very different from other bones. So we have got three structures in the skull bones: the outer table, the inner table, and in between we have got the diploid. The outer table here, as you can see, and inner table are actually the cortical bones. So when after the trauma, when we are seeing the CT scan of the brain, we usually sometimes get confused how to differentiate between suture and the fracture. So there are three ways in which we can differentiate suture from a fracture. One is the sutures are actually the serrated, and the fracture lines are actually straight. First, secondly, the sutures sometimes are bilateral, but the fractures are usually at the site of injury. There will be swelling and also associated fracture. And thirdly, as you can see at the suture line, the cortical bone is present. But if there is fracture, this cortical line will not be present. It will appear like this, black. So again, you can see sometimes the sagittal suture is single, but the coronal suture is bilateral present. So these are different ways in which we can differentiate between suture and fracture. We will see in the pathological significance when we will discuss the second part. We will discuss this in the second part. Then different dual folds I have already discussed. This is the fold cerebri, and here you can see the tentorium cerebri. In the coronal section, you can see this is the fold cerebri, and here this I was talking about. That it appears like a tent, and the cerebellum is going inside it. So if we take a section from here, in the periphery we will see the cerebral occipital lobe or supratentorial compartment, and in the center we will see the cerebellum. Let's move towards the vessels. I have not made a lot of slices about the vessels, but let's see. This here is actually the circle of Willis. As you can see bilaterally, these are the ACA. This is the middle cerebral artery, and posteriorly we have the got this basilar artery. And here a black color structure is the CSF cisterns, the basal cisterns. Then the normal calcifications I've already told you. In the pineal gland, we have got the normal calcification. Pineal gland is present behind the third ventricle. So these are the occipital horns, and the cortex plexus are calcified. This is the calcification of the pulse cerebri, and these are the calcification of the basal ganglia. So these are normal calcifications. Then how to identify the central circus on the CT scan brain plane. So here this is a sign which is known as the omega sign. So if this omega is can be seen, this is known as the central circus. In front we have the motor cortex, and posteriorly we have the somatosensory cortex. Motor cortex is usually thicker as compared to the sensory cortex. So here it is thick as compared to this one. Again, the orientation starting from the base of the skull going towards the vertex. So these are the maxillary sinuses, and posteriorly we have got the medulla oblongata cerebellum. As we move forward, upward, we can see the fourth ventricle, pons, cerebellum, and as we go up, you can see the different structures. Okay. Now, this is for you guys, so that you can know whether you have grasped all the knowledge which I discussed or not. If you can answer 80% of the questions, then it means you have grasped it, you have understood it. If you don't, then see the video again. So stop the video for 10 seconds, write all the answers which are shown here, and then start the video again. So it is 37, 38, 50, 52, 51, 53. So write all these, what are these structures, so you can know whether you have learned the CT scan brain normal anatomy or not. This is again the 1, 2, 3. You can see what are these structures. Then this one again. Stop the video here, write all the structures which are shown, and then see. Now I have not written the answers to these ones, so I'll tell you. 42 is the internal capsule, anteriorly move the internal capsule. This 44 is the insular cortex, because this is a Sylvian fissure. Then this is the interventricular foramen of foramen humondo, the 43. Then this 45 is actually a difficult structure because I have not discussed about it. This is actually the transverse sinus. Then this 67 is the cortex plexus, and 66 is the lateral ventricles. Okay. Thank you. Thank you for listening to this video. Like this video and subscribe this video so that I can continue to make these types of videos. Thank you very much.